let's talk about why do all the answer keys seem correct. Now, a lot of students struggle with this a lot. They will say every answer key on the NCLEX exam, they all look correct and stuff like that. The problem is you don't understand how the NCLEX write the question. Remember, I always used to talk about these three things: content, knowing how the NCLEX write the question, and understanding. Now, from the aspect of understanding how the NCLEX write the question, you'll be able to understand that NCLEX use two rules in writing your answer key. One, they can either make your answer key straightforward. Let me use SF, right? Straightforward, or they utilize the 70-100 rule, right? 70-100% rule, right? I'm going to explain, right? Like, let me just say this, right? 70% of your question, this is not anything related to this now. I'm just trying to say, now, if you are taking the NCLEX exam and you want to pass in 85 questions, 70% of this question, we follow this particular rule, 70-100% rule, whereby your answer key will be written to either be 70% correct, and then 30% statement in that particular long answer key will make the whole answer wrong. And it can just be straightforward in a sense that in a sense that NCLEX can just ask you something straightforward related to the body content. So this way you don't need to really over analyze the answer keys. All you just need to just select your answer. Right. So right, the straightforward one is what a lot of students like, because that way they can easily select their correct answer. Now, let me now explain the 70-100% rule so that you understand. Right. Now, it's just like this now. Let me give you example. Let me give you use use your armpit for use your armpit for support while using the crutches. Right now, let me add another one. Verify verify with another nurse using room number before blood transfusion. Right, before blood transfusion. Right. Let me add another one. Use Y tubing along with lactated ringers for blood transfusion. Right. Let's just work on these three. Now, the NCLEX can either write your answer key 70% of the time. Your answer key will be written 70% to be correct. So what we do is that we are still thinking like nursing school way of thinking, whereby we are either looking for a totally wrong answer or a totally correct answer. Right? There's no totally wrong answer on the NCLEX exam. Remove that from your mindset. The way NCLEX write the question, the answer key is that 70% of the answer key will be correct, but there's that one area of the answer key that will make the whole answer key to now be wrong. So you might be reading your answer key, and then what you know in nursing school is what they start with, and they will just state it. But the problem with a lot of students is that they don't completely read the answer key. The moment they just spot something that is correct, they don't completely read the answer key. They just select it that is correct. Now, when they now look at option 2 is now correct again. Then they are now lost. They are now lost, and they are like, number 1 is correct. Number 2 is correct. So what's the problem? Now, they don't know that NCLEX have that 30% in each answer key that totally make a correct looking answer wrong. So you need to pay attention to the whole statement. This is what I tell my students. Now, look at this first one. Use Y tubing along with lactated ringer for blood transfusion. Now, yes, we use white tubing for blood transfusion, but we don't use lactated ringer. So this is the wrong statement, or the 30% statement that make the whole answer key to be wrong. Do you understand now? Now, if a lot of students just see white tubing, they will say, yes, we use white tubing for blood transfusion. See, they don't care about the remaining answer key, because nursing school question, they don't write it like this. But NCLEX, this is the mindset of the NCLEX. Remember, NCLEX want to test to see if you are a safe nurse. This is how NCLEX write the answer key, to see if you can spot something wrong. That's the reason why I'm telling you, NCLEX don't want to trouble you with a lot of knowledge. NCLEX just want to give you the information, right? Like in nursing school now, your question in nursing school will make you think about the information, right? But on the NCLEX exam, you don't need to think about the information. The information is right on the answer key. You just need to approve the information if it is correct or not. Do you understand what I'm trying to say? Like in nursing school, if NCLEX is trying to test you now, it's just like right now, NCLEX maybe is trying to test you about, no, nursing school is trying to test you about hypertension sign and symptom. Now, nursing school will give you sign and symptom related to diabetes, sign and symptom related to MI, sign and symptom related to COPD, and one sign and symptom related to hypertension. So that way you need to start thinking about what? Sign and symptom related to what? Hypertension. So that you don't make mistakes selecting answers related to other disease condition. But NCLEX don't work that way. NCLEX don't want you to think about sign and symptom. Instead, NCLEX is going to tell you a patient have hypertension, which of the following findings require immediate follow-up. So they are going to even give you all the sign and symptom a patient with what? Hypertension is experiencing. So you are going to see all the sign and symptom. You don't need to think about the sign and symptom. All you just need to look at is which of the sign and symptom experienced by this patient require immediate follow-up. Right, you might say, okay, this patient's blood pressure is 136/70. You might say, okay, this is high. All right, what is the next one? They are saying somebody's having severe headache. That particular patient is having severe headache, or patient is having chest pain. Then you now say, oh, okay, headache can still be good. The blood pressure that is high, not too bad, but that chest pain is a problem. Then you now focus on that. These are things hypertension patient can experience, but because of that keyword, immediate follow-up, all these are correct, related to the symptom of hypertension, but the examiner is asking you for immediate follow-up, meaning there's only one that can be life-threatening among everything. So, but because you think like nursing school students, the way you answer question in nursing school, you are trying to look for the sign and symptom related to hypertension. So in nursing school, NCLEX is in nursing school, I mean, your lecturer is asking you about sign and symptom related to hypertension. But on the NCLEX is not asking you about sign and symptom related to hypertension. Instead, they're asking you for the sign and symptom that can be life-threatening based on the keyword immediate follow-up, immediate action, immediate intervention. Those keywords scream select priority. So now when you are reading the answer keys, you are thinking about the correct sign and symptom related to hypertension. That is the main reason why when you read all the whole sign and symptom on the NCLEX exam, everything are correct. Then you will not be lost. You will say, why are the answers all correct? Because you don't understand the NCLEX different from nursing school question. And this is what I teach students in my coaching program, so that they can be able to understand the difference between the writing style, because you need to know the writing style. Most question banks still write question like nursing school, right? Few are related to NCLEX writing style, but most are related to nursing school question. Right. NCLEX test from application level. Right. Application level upward. That's what you need to know. Right. So that is why the this one is wrong. Use white tubing along with lactated ringer, because white tubing is correct. Yes, we use white tubing, but lactated ringer is wrong. What we use is normal saline. We don't even use dextrose. NCLEX can put dextrose later, and then you see it and you say, oh no, dextrose is not there. That is the way NCLEX wants you to answer question. NCLEX is not trying to make you think a lot of things. Instead, NCLEX want to give you the information and find out what could hinder what safety. That is how NCLEX work. Now, the second option, use your armpit or axilla for support when using what crushes. Now, we understand that when you are using what? Crushes, we don't use our armpit. So the armpit is the one that is that 30% wrong statement. Right. We want to use something for support, which is true, but using the armpit is wrong. Using the axilla is wrong. What we use is what? Our hand and arm. That's what we use. This is the right thing. So since it's armpit, this is wrong. So even if we are trying to do support, armpit is the one that make it what? Wrong. You can see how the NCLEX work. Now look at the last one. Verify with another nurse using room number before blood transfusion. Now, I've seen a particular student was saying, yes, we do verify. She was arguing with me. She said, yes, we do verify with another nurse. I know this. I learned it. My lecturer told me this. I said, are you sure? Read the option again. She read the option 5 different times. This is where I knew this is a problem. And she was still saying that is the answer. She still sent me a screenshot when she Googled it, that was the answer, that they verify. But the question is not testing you on verify. He said room number is the problem. We don't use room number. That was when she now said, oh, okay, that is true. We don't use room number. We don't use bed number. We use patient name and date of birth. You can see the problem, right? Because she only focused on one part of the question just because she don't understand the NCLEX question. So that's the problem. So yeah, take note of this on your answer keys and you will definitely pass.